We are in the chapter of genetic disorders. In the previous lecture, we have discussed about the autosomal dominant disorders that are the type of the gene disorders or the Mendelian disorder. In this lecture, we are going to discuss the autosomal recessive disorders. Single gene disorder may be classified into different categories. It may be the autosomal linked disorder or the sex linked disorders. Autosomal may be the autosomal dominant or autosomal recessive. Sex linked may be the X linked disorder, and X linked may be X linked dominant or X linked recessive, and the Y linked. In the previous lecture, we have discussed the detail of the autosomal dominant disorder. In this lecture, we will discuss about the autosomal recessive disorders. Have a look at the list of the autosomal recessive disorders: cystic fibrosis, sickle cell anemia, thalassemia, phenylketonuria, albinism, Alkaptonuria, Tay-sachs disease, Xeroderma Pigmentosa, Galactosemia, Wilson disease, Hemochromatosis, Glycogen storage disease, and Gaucher's disease. These are the disorders due to the autosomal recessive inheritance. Starting with the cystic fibrosis. Cystic fibrosis is one of the most widespread inherited genetic disorder. Cystic fibrosis occurs only when both parents are carriers, which give their children a 1 in 4 risk of contracting disease, as the disease is autosomal recessive, so both the genes must be present in homozygous condition. Cystic fibrosis results when a lack of certain proteins is present and the balance of chloride in the body is not restricted. Cystic fibrosis की जो main cause है that is the disturbance of the chloride balance because of the lack of the protein that regulate the movement of the chloride ion. People with cystic fibrosis inherit a defective gene on chromosome number 7. This gene is called CFTR gene. CFTR stands for cystic fibrosis transmembrane conductance regulator. Cystic fibrosis transmembrane conductance regulator. This is the name of the gene, and it is present on the chromosome number 7. The protein produced by this gene normally helps salt, mainly the sodium chloride, move in and out of the cell. If the protein does not work correctly, if the protein is abnormal, or if the mutation in this gene occur, then the movement is blocked and abnormal, thick sticky mucus is produced on the outside of the cell. जब protein damage होगी, जब protein abnormal होगी, then there is no movement of the chloride ions and the thick mucus is produced on the surface of the cell, and this thick mucus leads towards the cystic fibrosis. The most seriously affected cells by cystic fibrosis are the lung cells. This mucus clogs the airways in the lungs and increase the risk of infection by bacteria. Mainly lungs को affect करती हैं, lungs में mucus का clogs बन जाता है जिससे airways block हो जाती हैं, and then it leads towards the different types of infections and leads towards the pneumonia. The thick mucus also blocks ducts in the pancreas, so digestive enzymes can't get into the intestine. It also affects the pancreas, gastrointestinal tract, gastrointestinal system. Symptoms include difficulty breathing, recurrent lung infection, digestive problems, and reproductive issues. Normal airways having no mucus, air wall, then air lines with a thin layer of mucus. Airways with the cystic fibrosis, thick sticky mucus block the airways, and there are the chances of different types of bacterial infections. Cystic fibrosis affect different organs like the sinuses, that is a cavity in our skull, sinusitis, that is an infection of the sinuses. It may affect the lungs, a mucus that build up in the bacterial infection, and widen airways. Skin, sweat glands produce salty sweat. Salty sweat is mainly it is a diagnostic procedure for the cystic fibrosis. Liver blocked biliary ducts, pancreas blocked the pancreatic ducts, intestine cannot fully absorb nutrients, and the reproductive organs may also be affected. Problems with the fertility or delayed puberty. These are different organs that are affected by the cystic fibrosis. So cystic fibrosis affect different organs in the body. Sweat test is used to diagnose the cystic fibrosis. There is no cure for cystic fibrosis. There are various treatments available that may help relieve symptoms and reduce the risk of complication. कोई proper treatment नहीं है, लेकिन supportive therapy can be used to reduce the risk of complication or to relieve the symptoms. Medication may be antibiotics, may be prescribed to get rid of a lung infection and to prevent another infection from occurring in the future. Mucus thinning medications make the mucus thinner and less sticky. Painkiller drugs like the NSAIDs can be used, such as the ibuprofen. NSAIDs are the non-steroidal anti-inflammatory drugs. Includes the ibuprofen and the indomethacin that may reduce the pain and fever that are associated with the cystic fibrosis. Pain और fever को कम करने के लिए these ibuprofen and indomethacin can be used. Bronchodilators that relax the muscles around the tubes that carry air to the lungs, which helps increase airflow. Airflow को increase करने के लिए bronchodilator का इस्तेमाल किया जा सकता है. Bowel surgery is an emergency surgery that involves the removal of a section of the bowel. If the mucus is increased in a specific part of the bowel, that it can be removed by the surgery. It may be performed to relieve the blockage in the bowels. अगर bowels में cream blockage आ गई है, उसको भी surgery से remove किया जा सकता है. Cystic fibrosis patients should do the following. Drink plenty of fluids because they can help in thin the mucus in the lungs. Plenty of water or plenty of fluids can thin the mucus and relieve the symptoms. Exercise regularly to help loosen mucus in the airways. Walking, biking, swimming are the great option. Avoid smoking, pollen and mold whenever possible. These agents can make symptoms worse. Get influenza and pneumonia vaccinations regularly. Antacids, multivitamins, and diet high in fiber and salt must be used. Cystic fibrosis patients are resistant to cholera and diarrhea. It is the importance of the cystic fibrosis. Second disease that is due to the autosomal recessive disorder is the sickle cell anemia. Sickle cell anemia occurs when the red blood cells are unable to adequate oxygen throughout the body due to their deformation. The structure of the RBCs changed from the biconcave to the sickle shape. Healthy RBCs are the disc shape, but those with the sickle cell anemia have crescent-shaped red blood cells. That's why it is called the sickle cell anemia. Patients with sickle cell disease have mutation in the gene on chromosome 11 that codes for the beta subunits of hemoglobin protein. It is autosomal recessive disorder. Chromosome number 11 पे जो beta subunit of hemoglobin protein को कोड कर रहा है जीन, उसके नंबर 6 पोजीशन पे एक पॉइंट म्यूटेशन होगी. उस पॉइंट म्यूटेशन की वजह से जो RBCs का स्ट्रक्चर चेंज हो जाएगा. Chromosome number 11, that is the hemoglobin gene. Sickle cell condition have an autosomal recessive pattern of inheritance from parents. Normally, humans have hemoglobin A, which consists of 2 alpha and 2 beta chains. Hemoglobin A2, which consists of 2 alpha and 2 delta chains. Hemoglobin F, consisting of 2 alpha and 2 gamma chains in their bodies. Of these three types, hemoglobin F dominates until about 6 weeks. 6 weeks तक hemoglobin F dominate होती है. Afterwards, hemoglobin A dominates throughout the life. Hemoglobin A having 2 alpha and 2 beta chain. 2 alpha and 2 beta chain that is in hemoglobin A, and it is the dominant form of the hemoglobin throughout the life. The gene defect in sickle cell anemia is a single nucleotide mutation of beta globin gene. Beta globin gene में single nucleotide mutation हो रही है. There changes GAG sequence to GTG. GAG sequence change हो रहा है GTG में. सिर्फ एक न्यूक्लियोटाइड ए की जगह रिप्लेस हो रहा है, ए को रिप्लेस कर रहा है T. After this mutation, this result in the substitution of glutamic acid by valine. जब ये म्यूटेशन होगी एट पोजीशन नंबर 6 ऑफ बीटा ग्लोबिन प्रोटीन, then the glutamic acid that is normally coded by GAG, it will replace by the amino acid that is the valine. This is the 6th position of the beta globin chain. The normal chain having the sequence that is the GAG, complementary of this is CTC. When the messenger RNA is formed, it will use this strand as a template strand. By using this, it will form a messenger RNA having a sequence that is the GAG. This GAG, it is a codon. It is responsible for an amino acid that is called the glutamic acid. If the glutamic acid is present in the beta globin protein, then the protein is normal. If the protein is normal, then the structure of RBC is normal. That's a disc-shaped biconcave structure. In case of the mutation in the sickle cell case, the A is replaced by the T. जब A को T ने replace किया, then it will code for the codon that is the GUG. जब normal था तो GAG था, that is glutamic acid. जब अब abnormal है, now it is the GUG. By this mutation, it is responsible for coding the amino that is called the valine. If valine is present in the beta globin chain, then the protein is the mutant. If the protein is mutant, then the structure of RBC is abnormal change. This is the sickle cell RBCs. So the mutation at the 6th position, this is the 6th position of the beta globin chain. The mutation at the 6th position in which the glutamic acid is replaced by the valine, the result in the sickle cell shape of the RBCs. Genetic pattern of the sickle cell anemia. The parents that are the heterozygous condition, these are the carrier. Both are the carrier. When we cross these two parents having the gametes HA and HS of this parent, and this parent also produce this these gametes of in the Punnett square, we have 1/4 the this is the normal, this is the carrier, this is the carrier, and this is the sickle cell patient or sickle cell offspring. So 1/4 are normal, 2/4 are carrier, and 1/4 are sufferer. Normal hemoglobin, normal red blood cells. Then the normal red blood cells are compact and flexible, enabling them to squeeze through the small capillaries. If the sickle cell is hemoglobin form the long inflexible chain sickle cell red blood cells, then the sickle cell red blood cells are stiff and angular, causing them to become stuck in the small capillaries. These RBCs were stuck in the capillaries, while the normal RBCs can squeeze through the small capillaries. Symptom of the sickle cell anemia: this genetic disease is extremely painful, causing abdominal, chest and bone pain, fatigue, shortness of breath, accelerated heart rate, delayed puberty, stunted growth, fever, and leg ulcers. All the characters, all the symptoms will develop in the body because it is the disease of the blood. The rapid breakdown of red blood cells may also cause yellowing of the eyes and skin, which are the signs of the jaundice. Episode of pains: periodic episodes of pain called the pain crisis are major symptoms of sickle cell anemia. Swelling of the hands and feet: the swelling is caused by sickle-shaped red blood cells blocking blood flow to the hands and feet. That's why hands and feet will swell. Frequent infections: sickle cell can damage spleen, leaving more vulnerable to infections. Vision problems: tiny blood vessels that supply eyes can become plugged with sickle cells. This can damage the retina, the portion of the eye that possess visual images, and lead to the vision problems. Pain medication, rounds of folic acid, kidney dialysis, and blood transfusions can help ease some symptoms of sickle cell anemia. Important point is about the sickle cell anemia is that the patients are resistant to malaria because the malaria mainly use the normal RBC for its replication, for its multiplication. If the RBCs are damaged or abnormal sickle shape, then malaria cannot propagate. Thalassemia. That thalassemia and sickle cell anemia both are related with the hemoglobin. लेकिन anemia में quality of hemoglobin change हो रही है. Quality of mean hemoglobin बन रही है लेकिन abnormal बन रही है. उस abnormal hemoglobin की वजह से जो structure है RBC का वो sickle cell हो रहा है. जबकि thalassemia में quantity of hemoglobin decrease होगी. Sickle cell anemia is the sickle cell anemia is the qualitative disturbance of hemoglobin, while the thalassemia is quantitative disturbance of the hemoglobin. Quantitative mean quantity decrease होगी जबकि qualitative mean quality disturb होगी जिससे structure disturb होगा. Thalassemia is the blood disorder in which the body makes an abnormal form or inadequate amount of hemoglobin. जब hemoglobin की मिकदार कम बनेगी, the condition leads towards the thalassemia. Hemoglobin is the protein in the red blood cells that carries oxygen. The disorder results in the large number of red blood cells being destroyed, which leads to anemia. Normally, the majority of adult hemoglobin, that is hemoglobin A, is composed of 4 protein chains, 2 alpha and 2 beta chains that are arranged in a heterotetramer. In thalassemia, patients have defects in either alpha or beta globin chains causing production of abnormal red blood cells. Thalassemia में तो alpha या beta globin chain defects होंगी जिससे red blood cells की production decrease होगी. In sickle cell disease, which is hemoglobinopathy and not a proper thalassemia, the mutation is specific to beta globin. सिकल सेल एनीमिया में सिर्फ बीटा ग्लोबिन प्रोटीन में म्यूटेशन हो रही है, वो भी 6 पोजीशन पे, जबकि थैलेसीमिया में बोथ can be affected. Types of thalassemia. The thalassemia are classified according to which chain of the hemoglobin molecule is affected. In alpha thalassemia, production of the alpha globulin chain is affected, while in beta thalassemia, production of beta globin chain is affected. Beta globin chain is affected. The beta globin chains are encoded by a single gene on chromosome 11. Alpha globin chains are encoded by 2 closely linked genes on chromosome 16. Thus, in a normal person with 2 copies of each chromosome, 2 loci encode the beta chain and 4 loci encode the alpha chains. There are many forms of thalassemia. Each type has many different subtypes. Both alpha and beta thalassemia include the following 2 forms: thalassemia major and thalassemia minor. जो अल्फा है उसका भी मेजर हो सकता है, जो थैलेसीमिया बीटा उसका भी माइनर हो सकता है. One must inherit the gene defects from both parents to develop the thalassemia major. Thalassemia major के लिए दोनों पेरेंट्स से डिफेक्टिव जीन का पास होना जरूरी है. Thalassemia often leads to an anemia which typically decrease hemoglobin in the blood and causes similar symptoms to occur, like fatigue, enlarged spleen, bone pain, propensity to broken bones, chances to the broken bones, shortness of breath, lack of appetite, dark urine, jaundice, yellowing of skin, and whites of the eyes, and liver dysfunctions. Treatment: blood transfusion, folate supplements, chelate therapy to remove the excess iron, and bone marrow transplant is the treatment of choice for thalassemia. Phenylketonuria. The phenylketonuria, that is a PKU, it is an inherited autosomal recessive disorder of metabolism that causes an increased phenylalanine in the blood. Phenylalanine is an amino acid. It mainly present in our diet. Phenylalanine comes from the person's diet and is used by the body to make proteins. It is a part of the protein. Phenylalanine is found in all food proteins and in some artificial sweeteners. Without dietary treatments, phenylalanine can build up to harmful levels in the body, causing mental retardation and other serious problems. Women who have high levels of phenylalanine during pregnancy are at high risk for having babies born with mental retardations. अगर प्रेगनेंसी के दौरान phenylalanine का लेवल हाई है, अगर phenylketonuria का प्रॉब्लम है, then the newborn babies have the mental retardation from the birth. They have heart problems, small head size, that is microcephaly, and developmental delay. This is because the babies are exposed to their mother's very high level of phenylalanine before they are born. Phenylketonuria affects about 1 in 12,000 babies. Males and females are affected equally. PKU is an autosomal recessive disorder caused by mutation in both alleles of the gene of the phenylalanine hydroxylase. Phenylalanine hydroxylase is an enzyme that is found on the chromosome number 12. 12q24.1 is the address of this enzyme. An enzyme phenylalanine hydroxylase converts the amino acid phenylalanine to tyrosine, that is another amino acid. Normally, phenylalanine metabolism, phenylalanine in the presence of phenylalanine hydroxylase converted into the tyrosine. Then it will lead towards different types of metabolic processes, epinephrine, dopamine, and melanin. These are different other components will form. In the absence of the enzyme, phenylalanine hydroxylase absent है, deficient है, phenylalanine will not convert to tyrosine. Tyrosine में convert नहीं होगा. It will accumulate in the body. The increase phenylketones leads towards the different types of problems. So, in simple, when the enzyme phenylalanine hydroxylase is deficient, it will not convert the phenylalanine to tyrosine. The condition leads towards the phenylketonuria. Symptoms of PKU, symptoms of the phenylketonuria range from mild to severe. Severe PKU is called the classic PKU. Infants born with classic PKU appear normal for the first few months after birth. However, without treatment with a low phenylalanine diet, these infants will develop mental retardation and behavior problems. Other common symptoms of untreated classic PKU include seizures, developmental delay, and autism. These are different types of symptoms of PKU. Boys and girls who have classic PKU may also have eczema of the skin and lighter skin and hair than their family members that who do not have the PKU. इसमें पिगमेंट्स भी सफ़र होते हैं क्योंकि ये एक जो नेक्स्ट पाथवे मेलानिन उसको भी अफेक्ट करता है, जो वो हम अल्बिनिज्म में डिस्कस करेंगे. Babies born with less severe forms of PKU, moderate or mild PKU, may have milder degree of mental retardation unless treated with a special diet. If the baby has only very slight degree of PKU, often called the mild hyperphenylalanemia, there may be no problem and special dietary treatments may not be needed. Treatment: avoid phenylalanine in diet. No beef, pork, chicken इसका इस्तेमाल बिल्कुल नहीं होगा. Limited carbohydrates, liberal fruits and vegetables, nutritional supplements will aid in the treatment of the phenylketonuria. Albinism. Albinism is an autosomal recessive disorder. Albinism is a genetic condition where people are born without the usual pigment color in the body. Normal जो color pigment है वो absent होता है, and the persons or the albino, their bodies are not able to make normal amount of melanin. Normal melanin प्रोड्यूस नहीं होता. The chemical that is responsible for eye, skin or hair color, वो chemical जो eye, skin और hair color की responsible है, this pigment is absent and the condition leads towards the albinism. Some people with albinism have very pale skin, hair and eyes. Albinism can affect people of all races. Albinism results from inheritance of recessive gene alleles and is known to affect all vertebrates including humans. It is due to absence or defect of tyrosinase. It is the absence of the tyrosinase enzyme, that is a copper containing enzymes involved in the production of melanin. Melanin प्रोड्यूस नहीं होगा. जब melanin प्रोड्यूस नहीं होगा तो कलर प्रोड्यूस नहीं होगा. Biochemistry of the albinism. phenylalanine जब इस पे phenylalanine hydroxylase एक्ट करेगा तो टायरोसिन प्रोड्यूस होगा. अगर phenylalanine hydroxylase नहीं है तो condition leads towards the phenylketonuria. अगर phenylalanine hydroxylase मौजूद है, टायरोसिन प्रोड्यूस होगा. टायरोसिन की सिंथेसिस के बाद टायरोसिन हाइड्रोक्सिलेज एंजाइम will produce the DOPA. DOPA is the dihydroxyphenylalanine. In the presence of the enzyme DOPA decarboxylase, it convert this DOPA into the dopamine. And in the presence of enzyme tyrosinase enzyme convert करेगा dihydroxyphenylalanine, that is a DOPA, into the melanin. डोपा को मेलानिन में कन्वर्ट करने के लिए जो एंजाइम है दैट इज टायरोसिनेज. अगर टायरोसिनेज एंजाइम मौजूद नहीं है देन देयर इज नो कन्वर्जन ऑफ द डोपा इनटू मेलानिन एंड द कंडीशन लीड्स टुवर्ड्स द अल्बिनिज्म. कंडीशन लीड्स टुवर्ड्स द अल्बिनिज्म. अल्बिनिज्म नहीं होगा. अल्बिनिज्म का जो वन ऑफ द फैक्टर है वो दिस फिनाइल हाइड्रोक्सिलेज भी है. अगर फिनाइल हाइड्रोक्सिलेज नहीं है तो this pathway may be affected, that leads towards the albinism. पूरा pathway affect होगा. सो अगर फिनाइल अलाइन हाइड्रोक्सिलेज नहीं है तो फिनाइल केटोनुरिया, अगर टायरोसिनेज नहीं है तो अल्बिनिज्म. There are different kinds of albinism. Ocular cutaneous albinism. Some people with a condition called the ocular cutaneous albinism have extremely pale skin and eyes and white hairs. Others with this same type of albinism might have slightly more color in their hair, eyes, or skin. Ocular albinism, for some people, albinism affects only their eyes. This is known as ocular albinism. Ocular albinism में सिर्फ eyes affect होंगी. People with ocular albinism usually have blue eyes. Albinism. Some case the people having the red eyes may be observed with albinism. Treatment: no cure of albinism. Just be away from the sun. Regularly visit the dermatologist. Dark glasses and dark contact lenses in case of albinism because the skin and the eyes are sensitive to light. Alkaptonuria. Phenylketonuria, albinism और alkaptonuria. तीनों these three types of the autosomal recessive disorders are due to the enzyme disturbance. और एक ही पाथवे को अफेक्ट करती है ये. Alkaptonuria is a rare inherited genetic disorder which is caused by a mutation in the HGD gene for the enzyme homozygosate 1,2-dioxygenase. The enzyme is homozygosate 1,2-dioxygenase. जीन इज HGD जीन. इसकी डिस्टर्बेंस की वजह से एंजाइम बनेगा. उस एंजाइम को बोलते हैं homozygosate 1,2-dioxygenase. If a person inherits an abnormal copy from both parents, it is a recessive condition. The body accumulates an intermediate substance called homozygosic acid in the blood and tissue. Homozygosic acid will accumulate and the condition leads towards the alkaptonuria. Homozygosic acid and its oxidized form alkaptone are excreted in the urine, giving it an unusually dark color. Alkaptone and the homozygosic acid will excrete in the urine, and it will be responsible for the dark color of the urine, and this dark color of the urine is pathognomonic for the alkaptonuria, specific symptom of the alkaptonuria. बायोकेमिस्ट्री ऑफ द अल्कैप्टोनुरिया साइकिल सेम. फिनाइलएलानिन पे फिनाइल हाइड्रोक्सिलेज एक्ट होगा, टायरोसिन प्रोड्यूस होगा. टायरोसिन अमाइनो ट्रांसफेरेज इसको कन्वर्ट करेगा फॉर हाइड्रोक्सी फिनाइल पायरुविक एसिड. देन the enzyme that is the 4-hydroxyphenyl pyruvic acid dioxygenase will convert this into the homozygosic acid. Homozygosic acid will convert it into the male acetoacetic acid by using enzyme homozygosate 1,2-dioxygenase. अगर homozygosate 1,2-dioxygenase enzyme नहीं है then it will lead towards the disease that is called alkaptonuria. So alkaptonuria में क्या accumulate होगा? alkaptonuria में homozygosate acid will accumulate and it is due to the deficiency of the enzyme that is homozygosate 1,2-dioxygenase. It will affect the further all the process and it will lead towards different types of abnormalities, and this homozygosate acid will and the alkaptone will responsible for the black color in the urine. So homozygosic acid will accumulate due to deficiency of homozygosate 1,2-dioxygenase, and the condition leads towards the alkaptonuria. Symptoms of Alkaptonuria: dark spots in the sclera, white of your eyes, thickened and the darkened cartilage in your ears, blue speck discoloration of your skin, particularly around sweat glands, dark color sweat or sweat stands, black earwax, kidney stones and prostate stones, arthritis, especially hip and knee joints, heart problems. Tendinitis, that is tendons, inflammation of tendons, kidney problems may be observed, and the back problems may be observed. Ochronosis, that is the darken of different area of the skin, black urine. Some commonly recommended treatments include the large doses of ascorbic acid, vitamin C, or dietary restriction of amino acids, phenylalanine and tyrosine can be a treatment of choice. ऐसी खुराक जिसमें टायरोसिन और फिनाइलिन कम हो, ऐसे अमीनो एसिड इसके जो चांसेस ऑफ अल्केटोनुरिया को कम कर सकते हैं. Tay-sachs disease. And the Tay-sachs disease is caused by a genetic mutation in the hexa4 gene on chromosome 15, which codes for a subunit of hexosaminidase enzyme known as hexosaminidase A. It is inherited from parents in an autosomal recessive manner. The mutation disrupts the activity of the enzyme. It is also the enzyme deficiency disease, which results in the buildup of the molecule GM2 gangliosides within the cells, leading to toxicity, results in excessive accumulation of certain fats, lipids, known as the gangliosides in the brain and nerve cells. चूंकि लिपिड मेटाबॉलिज्म नहीं हो रही, गैंग्लियोसाइड्स और लिपिड की जो मेटाबॉलिज्म नहीं होगी तो वो एक्यूमुलेट कर जाएंगे और उससे नर्व्स और ब्रेन प्रॉब्लम्स प्रोड्यूस होंगे. Healthy neurons, lysosome are normal. Neuron affected by the Tay-sachs disease, gangliosides will store, and the bulging lysosomes are in the large structure. As the disease progresses, children with the Tay-sachs disease experience seizures, vision and hearing loss, intellectual disability, and paralysis. An eye abnormality called the cherry red spot, which can be identified with an eye examination, is characteristics of this disorder. Cherry red spot is the important character of this disorder. Characteristic features including the muscle weakness, loss of muscle coordination, ataxia, and other problems with movement, speech problems, and mental illness. Next disease disorder due to the autosomal recessive inheritance is the Xeroderma Pigmentosa. It is an autosomal recessive disorder. As we are discussing the autosomal recessive disorders, it is with at least 9 specific mutations that are able to result in the condition of Xeroderma Pigmentosa. Xeroderma pigmentosa, there is a decreased ability to repair DNA damage such as that caused by ultraviolet light. Ultraviolet light की वजह से जो DNA डैमेज होता है उसमें रिपेयर की एबिलिटी डिक्रीज होती है Xeroderma pigmentosa में. Symptoms may include a severe sunburn after only a few minutes in the sun, freckling in the sun exposed areas, dry skin, and changes in skin pigmentation. Nervous system problems such as the hearing loss, poor coordination, loss of intellectual function, and seizures may also occur. Complications include a high risk of skin cancer. There may be high risk of other cancers such as brain cancer. There is no cure of XP. Treatment involves completely avoiding the sun. This includes protective clothing, sunscreen, and dark sunglasses when out in the sun. Retinoid creams may help decrease the risk of the skin cancer. Vitamin D supplementation is generally required. Next disorder is the galactosemia. Galactosemia is an inherited autosomal recessive disorder. Galactosemia is the accumulation of galactose in blood. It is a rare genetic metabolic disorder that affects an individual's ability to metabolize the sugar galactose properly. Galactose properly metabolized नहीं हो रहा, accumulate हो जाएगा. That condition is called galactosemia. It causes the deficiency of the GALT gene. The cause of the galactosemia is due to deficiency of the GALT gene. Symptom hepatomegaly, an enlarged liver, cirrhosis, kidney failure, cataracts, vomiting, seizure, low blood sugar, hypoglycemia, lethargy, brain damage, and ovarian failure. Without treatment, mortality in infants with galactosemia is about 75%. Glycogen storage disease. A glycogen storage disease, also known as the glycogenosis and dextrinosis, is a metabolic disorder caused by enzyme deficiencies affecting either glycogen synthesis, glycogen breakdown, or glycolysis. Glucose breakdown typically in muscles or liver cells. Glycogen storage disease has two classes, genetic and acquired. Genetic GST is caused by an inborn error of metabolism. Genetically defective enzymes involved in these processes. Wilson disease. Wilson disease is an inherited disorder in which excess amount of the copper accumulate in the body, particularly in the liver, brain, and eyes. Wilson disease is caused by mutation in the Wilson disease protein ATP7B gene. This protein transports excess copper into bile where it is excreted in waste products. The signs and symptoms of Wilson disease usually first appear between the age of 6 and 45, but the most often begin during the teenage age as well. The features of this condition include combination of liver disease and neurological and psychiatric problems. Hemochromatosis. Hereditary hemochromatosis is disorder that causes the body to absorb too much iron from the diet. The excess iron is stored in the body's tissue and organs, particularly the skin, heart, liver, pancreas, and joints. Iron की concentration ज़्यादा होगी and it will store in different areas of the body. Human cannot increase the excretion of iron. Excess iron can overload and eventually damage tissues and organs. मतलब organs और tissue damage हो जाएंगे. For this reason, hereditary hemochromatosis is also called an iron overload disorder. Hemochromatosis iron overload disorder. Gaucher's disease. Gaucher disease is caused by a recessive mutation in a GBA gene located on chromosome 1 and affects both males and females. In Gaucher disease, glucocerebrosidase, a sphingolipid also known as the glucosylceramide, accumulates in cells and certain organs. Deficiency of enzymes glucocerebrosidase, also known as the glucosylceramidase, which acts on the glucocerebroside. When the enzyme is defective, glucocerebroside accumulates, particularly in the white blood cells and especially in macrophages, mononuclear leukocytes. Glucocerebroside can collect in the spleen, liver, kidneys, lungs, brains, and bone marrow. The disorder is characterized by bruising, fatigue, anemia, low blood platelet count, and enlargement of the liver and spleen. That's all about the autosomal disorder, recessive disorder. The most important disorders are sickle cell anemia, cystic fibrosis, phenylketonuria, albinism, alkaptonuria, and Xeroderma pigmentosa.